beginning of the epidemic, where the hospitals were packed with AIDS patients, where the staff was afraid to go into the rooms. They would leave the trays on the floor.
White male with HIV, they were the focus. But our fight was also that we minorities, that we didn't necessarily feel represented.
Some people were seeing the AIDS epidemic raging in our community. They could not turn a blind eye to what they were seeing. According to my mom, at the time, there was a lot of talking around kitchen tables around a lot of these issues for many years. A meeting was convened of various people, including my parents, Josie and Jose Morales, and our beloved Dennis de Leon, to talk about how to go forward. And the other person that Mom remembered vividly at that first meeting was Helen Rodriguez Trias, who was a leader in our community, first Latina president of the American Public Health Association. And that meeting led to the founding of the Latino Commission on AIDS.
Their vision was to create an organization that will combine programs, build advocacy, and also ensure to involve those most impacted by this epidemic.
In the 90s, and talking about HIV and being gay, we Latinos always been a little bit invisible. And that's what it was with Dennis. It's putting a face to the Latino community.
When Dennis de Leon took over the Latino Commission on AIDS in September 1994, the signature was to do something that will bring innovation and will be different than anybody else was doing. And it was a commitment from the Commission to develop an initiative within the Latino faith-based communities. Second piece was treatment education. We launched Treatment Now because we were convinced that if you don't empower the individual about what is HIV and what is your treatment options, the whole concept of retention in care will never be met. And the third initiative at the beginning was working with Latino, gay, lesbian, bisexual, transgender, and support them.
There's a lot of things that is empowering you in this society. And I think the Latino Commission really helps to empower individuals who had been disempowered by bringing this personal power and moving forward and transforming their lives.
People were asking the Commission to go to North Carolina, to go to Georgia, to go to Texas, to go to Puerto Rico. And our work began to be driven by what the needs were unmet outside New York.
So what the Commission did is they implemented a capacity building assistance program. We provide training to organizations so they can develop in their local towns leadership and they can develop services. We created a National Latino AIDS Awareness Day, and every year there are 150, 200 events nationwide where local communities organize this event. So we create a model, they implement it, and they grow the model.
Back in 2009, we lost Dennis due to HIV/AIDS complications.
We thought we were prepared, but still it hit very hard. It hit very hard.
Dennis was a visionary. His leadership was so important in making the organization, stabilizing it, growing it, institutionalizing it, so that as long as the need remained, the passion and the effectiveness remained. And so that now we're in this next stage of the Latino Commission where the torch was passed in terms of the leadership of the organization.
Dennis asked me, don't leave. If I died, I don't want you to leave the organization. And I say, if the board keep me, I will continue. I hope you are very happy. The test right now is how we maintain or sustain that sense of urgency, especially with young folks.
HIV has been good in terms of teaching us how to advocate, and not just to get better services, but also to educate the community.
3 years ago, the Latino Commission on AIDS began to facilitate the creation of the Hispanic Health Network. And the vision is to really address HIV, hepatitis, health disparities, cancer, other issues that really impact also Latinos and Latinas throughout the U.S. Those are the concrete new challenges as we reach 25 years of hard work and honoring our pioneers that built this amazing organization.